Right now, let's welcome my first guest of this hour, Chief Executive of the NHS Confederation, Niall Dickson, who joins us. Good morning to you, Neil.
Good morning.
Morning. What did you make of what the Prime Minister had to say, given that obviously the people you represent, the NHS Trust, are going to have to deal with any of the fallout from the easing of the lockdown? What did you make of it?
Well, I suppose on the one hand, the message was clear, as you've just said, and the message that we're still in danger is absolutely clear. On the other hand, I think, as you touched on as well, it signalled a less binary approach, and I suppose the question is that may be more open to inadvertent or even calculated misinterpretation, because you're going from something which does require a little bit more judgment than you might have if you had a simple and straightforward message.
Yes, but I think don't leave your home is very, very simple, isn't it? Apart from the fact, of course, that millions of people do go out to work all whole way through this lockdown, and many millions more were expected to. The furlough scheme was more than 6 million people, but that wasn't the plan. They were expecting most of those people to still be at work.
They were certainly expecting some of them. I think from the NHS point of view, and I think everybody accepts everybody is desperate to return to some kind of normality, and to be honest, a lot of progress actually may be made. But from a health service point of view, we're still treating thousands of patients. There's the tragedy unfolding in care homes. Not sure we've really cracked the PPE, the protective equipment challenge, and we're not yet ready to roll the test, track and trace strategy out. And I think all those were in a way reflected in what the Prime Minister has said. The problem is that people interpret it as being, something more than that. So I think, if it is just a tentative, and I think that's the suggestion, it's a very, very tentative step. And I would quite like the idea of this alert system, which would enable you to go backwards, because I think moving out of lockdown is actually more difficult than imposing it. And the NHS is saying, actually, to start these services up, which we're now being expected to do itself, is actually more difficult than shutting them down in the first place, especially when you start them up with the virus still there and all the kind of measures you've got to take in order to deliver that.
Yeah, I mean, that's the thing. It is going to be very nuanced. As we know, it is going to be changing all the time, depending on that R number. And I suppose that's where the alert system, much mocked yesterday, would actually be quite useful to give people a clue of where we are. But you raised the point again of failures on PPE. Undoubtedly, there have been failures on getting PPE. We know that's been a problem for governments around the world. The French and the Germans are also angry with their government's failures on that. That doesn't excuse it, though. But also the failures to carry on testing and tracing, and therefore having to sort of build it up again from scratch. But is there not increasing evidence that most of the infections that are happening right now, most of the transmission, has actually been happening in care homes or in hospitals, and actually largely in the community we are seeing a much lower rate of transmission?
I think that's right, and again, there are variations around the country, so it is true that the infection rate in Scotland may be slightly higher than elsewhere. So I think understanding, one of the key points about testing, of course, is to try and understand how the virus is spreading and where it is spreading. And so you would be more optimistic if you were just looking at the community. I mean, the tragedy of care homes, and no place is sealed. So if you have a high rate in care homes, of course, as well as it going into the care home, there's the danger of it coming out as well, as staff and so on move around. So I think it is a complicated picture, and that's why I think the government is right, all the governments of the UK are right, to be extremely cautious about how you do this. But again, remembering that this stuff is not without cost. I mean, it's a huge cost in mental health and physical health, as well as obviously the huge economic impact of it as well. So it's getting that balance right, and I think that's obviously what they're trying to do. On getting test, track and trace into place, I think it is really important. One of the key points I think government has to learn is a simple national approach to many of these things, as we've seen with PPE, is not probably the right approach. You have to combine whatever it is you want to do nationally, but you really have to fire up and give much more control to people locally. And test, track and trace, as I understand it, will not simply work if you have a national and an app system. You need to have those tracers on the ground, and you need to work with local public health to do it.
Yeah, indeed, and this is these two issues in terms of the testing and the PPE have been ongoing issues and have been really, really crucial. We think in actually the spreading of disease. There's quite a lot of focus again over the weekend. We had those faulty gowns being ordered from Turkey, the money being handed over before they were delivered, when they turn out not to reach our standards. Then it emerged at the weekend that we got 25 million faulty goggles that have been distributed already in the NHS, but also this extraordinary knowledge that apparently our UK laboratories have got such a backlog now of all these tests that 50,000 UK swab tests, these the antigen tests that people have been able to take, have been sent to the US labs to be analysed. And yet again, a week and a half or so since we've had that 100,000 tests a day target from Matt Hancock, it was reached technically on the day. It's not been reached again. Are we alone in this country in having these sort of failures? Because, with the best will in the world, wanting to be supportive of a government during a crisis time, frankly, as a taxpayer and as a concerned citizen, it doesn't seem good enough.
It describes a system that itself is under very considerable stress, and there are desperate measures to try and maintain the supply. On the positive side, I would say most of our members, certainly those in hospitals and even in some community services, would say the supply is better than it's been. The supply is a bit more constant than it's been, but there are still problems, which is the important thing in terms of delivery. There are still parts of the system that are still struggling and are still very anxious about the kind of hand-to-mouth process. I think there is, and I think they're right to be cautious about it, but I think at the centre there's something of, as long as we don't have another peak, as it were, there's confidence that going forward they are beginning to manage to source some constant larger suppliers from overseas, and that they have begun to crank up domestic supply. In the longer term, I think the aim has to be to have a reasonable, it won't be 100% or anything like it, but a percentage of supplies which are delivered here and are domestically produced in order to at least have that kind of fallback. And I think that is what is being put in place.
Yeah, indeed. Again, lessons will be learned for the future. Are you concerned about the fact that in places like South Korea they've seen a spate of extra cases after one man apparently went on something of a pub crawl and managed to spread the virus to a huge number of people? And also in 2 states of Germany, they've seen their R number go back to 1.1. Anything above 1 we know can then lead to exponential growth. That actually, coming out of lockdown, it's going to be very stop-start. Are those figures concerning to you?
Yeah, I think they are, and always these comparisons with other countries, some of which, of course, are held up as models and will if only we followed them. I think we don't understand quite a lot about the comparisons and the international comparisons and how the figures are calculated. But I think what those two instances absolutely illustrate is that getting out of this is going to be more difficult than going into it, in the sense that it's not easy, but the NHS did an amazing job expanding itself and gearing itself up for a completely different challenge. But actually undoing that and starting services again will be not just an equal challenge, but probably even greater. And places like in community services, which people don't talk much about, I think there's genuine concern there that if the hospitals all start gearing up their activity too quickly, then the community services simply won't be able to cope with the volume of patients that are coming back down the system, as it were, going forward. So I think in this very delicate and interdependent system, getting it back up again with a huge backlog of unmet demand is going to be a huge challenge.
Absolutely. Niall Dickson, thank you so much for joining us, Chief Executive of the NHS Confederation.